Good evening. My name is David Merriman, and I want to welcome you to tonight's forum, where we will be talking about federal changes to the SNAP and Medicaid program. We are so grateful that we have a partner in Cuyahoga Community College that has made tonight's event possible. Tri-C is a backbone organization, and there is no better place than Tri-C's campus in this downtown area for us to start a community conversation. And I will be inviting Claire Rosacco up in a second to share more about Tri-C. But as we begin, I want to start by letting everyone know we are live casting on YouTube. We are recording tonight's event. And I would ask you to consider placing your phone on silent until the end of the presentation, just so that we're not distracting anyone. We do have sign language here, obviously, tonight. And so if there are folks that have other accommodations, if you could please approach one of the organizers. We're happy to either find a seat in the area that will make it easier for you to participate, or if you have other accommodations you'd like to let us know about, we'd like to know them. So at this time, I'm going to invite a great colleague of mine, Vice President of Government Relationships for Cuyahoga Community College, to come up, Claire Rosacco. Claire.
Hi, everybody, and welcome to Tri-C. You're in our Jerry Sue Thornton Center community room, and we are so happy to have you join us here today. This is not an easy topic, and we know that, but our community always helps each other, right? We have a great, great community. You may be familiar with Tri-C and think of us primarily as maybe academic degrees, associate degrees, and we do a lot of that. That's okay. But what people sometimes don't realize is how much workforce training that we offer. And that could be in anything from maybe a CDL truck driver. We can train in 6 to 8 weeks. We would help job place, and those wages starting are about $60,000 out of the gate, just for example. But things like maybe it's in IT. Honestly, if you can think it, we're probably offering it somewhere in this institution. So I asked to be on the program to say, please get the word out. Let us help people. That's what we do. That's what we love to do. I'm going to introduce you to Sarah Baldwin, who's in the back of the room. Hey, Sarah. Thank you for joining us. Sarah is a recruitment specialist from our workforce innovation team. She is also going to have a table out in the foyer for people to grab information about us. But she does expert counseling and help in finding job training for people. So I really appreciate Sarah being with us. I'm going to give you a number. I'm going to give you Sarah's direct line. So if you have people that need her help or you have questions about programs, call Sarah Baldwin. She's at 216-987-4576. We have financial aid available, so people shouldn't be worried about, gee, I haven't come back to school in 30 years. It's okay. We're going to get you wherever you start, wherever you are, we're going to help you from wherever you are. And that's what we'd like our community to know. So if you can take that first step, know that we're accessible. We would love to have more people come and be at Tri-C. We have the capacity, and we have great faculty and instructors to help. So we hope people come and let us help you along your journey. And I hope you enjoy the session today. Thanks for being with us. Thank you.
I neglected to ask if you could make note of your questions. We will have a lengthy question and answer section after our panel presentation. So the agenda for tonight is after introductions, we'll have a brief presentation from Kevin Gowan. We will have a panel presentation, and then we're going to open it up for questions. So please make note of your questions, and we'll be sure to get to them at the end. It's now my pleasure to invite Cuyahoga County Executive Chris Ronayne to come forward. Thank you, Chris.
Good evening, everybody. Good evening. I will be brief, but I just want to say it is so affirming to see such an army of friends out here tonight at Tri-C. And I want to thank Claire and the team at Tri-C for having us. Also, seated at my table, I've seen Jasmine twice today from Congresswoman Chantel Brown's office and her colleague Aisha. Thank you guys for being here. Congresswoman Brown has just been an incredible partner to us as always every year in and out, but especially in helping us sort of brace for what's ahead. And I don't probably need to tell too many of you, I know you're area experts on the subjects of what is ahead, but it is something that I feel we are all going to have to brace ourselves for, because there are changes that are coming that you're going to hear about tonight from our panelists. And thank you, panelists, for being here. And from our consultants and our experts, Emily Campbell, appreciate all the work you do at the Center for Community Solutions, and Kevin Gowan, who works with David Merriman and is our Director of Jobs and Family Services. We don't know exactly what rules are coming when from Washington, but we know the world is going to be different. And I've said a few occasions of late, I feel like we sisters and brothers are going to have to band together like we did when we were in COVID. We're going to have to make sure that our neighbor is taken care of. And I know in your hearts, you wouldn't be here if you weren't that kind of person. The intermediaries in the community that can literally help people find their way and navigate to what they need in terms of benefits, in terms of just community resources if they have not benefits because of the changes. You are the navigators. And so I look out to you with great thanks in advance for stepping up and being here on such a sunny, beautiful September night and being here in this beautiful Tri-C room. But we know, and you're going to hear more about what is coming. As your county executive, I'm proud to work with you. I always say we have the best public-private nonprofit partnership in the land, and I mean that. It's truly a blessing to have so many nonprofits that work on the front line in constituent services, and our private sector partners. Dan, I'm just going to point you out, but Dan Salzman I saw here today from Dave's Supermarket, a great private sector partner who's in the community and provides such benefit to our residents. We had a quick conversation that I told him I've been thinking about in other ways. When somebody someday steps up to an aisle in a grocery store line with an EBT card and somebody on the other side, a clerk that says, I don't know what to do, you don't have anything on that card. That's what's coming, but what we can do is help people navigate through that and find the resources they need to make it. I do believe that this community will step up and show our finest hour ahead. I really do believe that we, because of who we are, will show our finest season ahead, that we will have each other's backs. We were really built to be a community that serves and cares. Our foundation community is strong, all the nonprofits I referenced. And as I remember back to my first term of service at Cuyahoga County, we went through something called the Workforce Reconciliation Act. It's kind of crassly called the Welfare to Work Act. And we help people, though, with benefits, and we help people find jobs. We help people find daycare. We help people find transportation to those jobs. And we're going to be seeing that kind of need again from all of us. You guys as navigators who can help people. And for those who are on direct benefits, I want to say thank you for being here. 30% of Cuyahoga County has Medicaid assistance. It's a vitally important health insurance plan for all who need it. 30% of our community, 20% are on supplemental nutrition assistance for program for families, SNAP, excuse me, and easier said, but 30% and 20% respectively. This is a large population within our community who are our sisters and brothers and our neighbors that we need to continue to help them get what they need in the way of food, health insurance, housing, and a job. We didn't write these rules. We didn't ask for this, but it's coming into our community. And let's face it, we're going to have to step up to weather a storm ahead. I look to you, though, with such pride that there is no better community than Cuyahoga County to step up together and help each other through this. So thank you. It's an honor to be with you tonight. Some of my fellow elected officials, I see State Representative Chris Glassburn. Thank you for being out here tonight. Yvonne Conwell, who I'm going to introduce. And is there any other elected officials in the House besides Chantel Brown's office too? All right. Well, thank you. And but most importantly, citizens, thanks for coming out. Intermediaries, thanks for coming out. Everybody in the public-private nonprofit partnership. Again, we're strong together. Here we go. Yvonne Conwell, my colleague who I saw all day today, our Vice President of County Council, our chair, almost all day. Well, I saw Jasmine very early today, our chairwoman of Health and Human Services, and she does a wonderful job and she leads from the heart. Yvonne Conwell.
Good evening, everyone. I want to thank everyone for coming out. It shows that you care. We're all in this together, as we all say. And as chair of the Council's Health and Human Services and Aging Committee, and someone who is actively and deeply rooted in their community, I'm deeply concerned about these SNAP and Medicare changes that we're all facing. Some of our own specific loved ones receive Medicaid as well, as well as SNAP. So I don't think any of us are not concerned that it's here tonight. These programs are real lifelines. They're changes that determine if they're going to actually have food on their table or access to health care, which you will hear from the panel tonight, how it's going to affect all of us. So we all know what we must do in 4 years, and that's what I'm going to say about that. But that's why it's important to not only to me, but all of County Council this evening. You know, we have always had an open ear to listen in public comment, hear the concerns from the residents that come down and tell us long wait times, long calls, we can't get in. And we've worked with the administration, the previous as well as the current one, in trying to hear your voices and your concerns and get those changes changed to better impact the residents that we all serve. Medicare and SNAP, I want to tell you, when I first started out, I'm going a little off script, they made a dot chart for us who was impacted by those services. And that was roughly 14 years ago. Let me tell you, that map has expanded tremendously. This is all over the county. It's not just the east side or a small little section anymore. It's everybody, all of our other residents that are not working or have the pleasure to work. So I just want to give a plug for Claire Risacco. Please call Sarah Baldwin. I'm going to say that. 216-987-4576, because this is serious. This is serious business. So now I have the pleasure to introduce Jasmine Butler, which is my neighbor, representing our Congresswoman Shontel Brown.
Good evening. And thank you, County Councilwoman. I do get to see her every day right over the fence. My name is Jasmine Butler, and I am honored to serve as Congresswoman Brown's District Director. And on behalf of Congresswoman Brown, I want to thank you for being here tonight to discuss an issue that touches the heart of our community: access to health care and food security. These are not abstract policy debates. They are about whether our neighbors, our families, and our friends can live with dignity and stability. The changes we are here to discuss come as a result of the recently passed Republican budget bill. Now, let's be very clear. Congresswoman Brown opposed this bill, submitted amendments to this bill to try to get rid of some of these changes, and voted against this bill. And she's going to keep fighting to reverse the changes that are being discussed tonight. And if you've heard her, you know she calls it a big, ugly bill because of the new work requirements and funding cuts to SNAP and Medicaid. These measurements do not strengthen families or communities, and they place barriers in front of the very people who need support the most. She knows it will add layers of unnecessary red tape that will make it harder, not easier, for residents to get the health care and nutrition they need. And instead of uplifting people, it risks pushing them into crisis. That is why Congresswoman Brown voted against this bill. But now that the bill has become law, we need to be prepared and proactive so that we can make sure as many people as possible are covered. Tonight, we will learn what these changes mean and how they may affect healthcare and nutrition access here in Cuyahoga County, and most importantly, what steps you can take to prepare. Being here matters. Understanding the information matters, and sharing what you learn with others matter, so we can help our neighbors as well. I'd like to take a moment to thank one of the most popular people in the room. I see Ms. Claire Risacco and Cuyahoga Community College for hosting this event and for always being amazing partners. I want to recognize County Executive Chris Ronayne, his leadership, and his team for their commitment to ensuring that constituents continue to receive timely information to protect the benefits they have and to prepare for the changes ahead. Now, while these programs are shaped by federal decisions, they are administered locally here in Cuyahoga County. And that makes the partnership between federal and county government critical in making sure resources reach the people who need them the most. Tonight, we're surrounded by many community partners who are working tirelessly to provide education, resources, and access to our residents, from healthcare providers to nonprofit organizations and even faith leaders and advocates. Your efforts are invaluable, and we are grateful for your partnership and commitment to standing shoulder to shoulder with us in the fight. The purpose of this meeting is clear: education and empowerment. We're here to ensure every resident has the knowledge to protect their benefits and confidence to navigate these changes, and the power to help others to do the same. On behalf of Congresswoman Brown, we thank you for your commitment to learning, to advocacy, and to each other. And together we will continue to push for fairness, compassion, and opportunity for every resident in Cuyahoga County in the 11th Congressional District. Thank you.
Okay. Before we move forward, I do want to just ask folks to recognize in the back of the room we have refreshments. Please feel free to get up, grab a cookie, have some coffee. We're here for the next hour or actually hour and a half, and the refreshments have been provided us. Please feel comfortable getting up and going in the back. But we are here today to talk about something that touches at the very heart of who we are as a society. It's our responsibility for one another. Here in Cuyahoga County, we are fortunate to have an incredible safety net system. As the director of the Department of Health and Human Services, it's my pleasure to get to work with our 8 departments. Actually, I'm going to pause for a second. If you're here, an employee, can I ask you to raise your hand? Thank you very much as public servants for doing the work you do and for being here tonight. I also want to pause and thank the servers who brought food forward and who are working with us tonight as well. Cuyahoga County stands out as our largest provider of vital safety net services. The department's fabulous eligibility specialists, these are the staff that work in Cuyahoga Job and Family Services, are the lifeline for hundreds of thousands of residents in need, calling, asking for help. Many are providing SNAP benefits so families can put food on their table the next day. They're securing Medicaid so that seniors can get the health care they need to live. They're providing childcare so working families can work. These are the stakes that we're talking about. Cuyahoga Job and Family Services serves more children than Children's Services, more seniors than Senior Services, more families than Child Support Services. It is the backbone that ensures our most vulnerable neighbors, from our youngest children to our oldest seniors, our oldest residents and our oldest neighbors, are not forgotten. But the new law threatens to unravel that safety net. It introduces changes that will make it harder and in some cases impossible for people to receive the help that they need. This isn't just about a few additional forms that residents will have to do, some more red tape. This is about real people. The law that is now in effect will not only increase complexity for agencies like Cuyahoga Job and Family Services and its partners, many of whom you represent here today. It will mean that the hungry will go hungry, that the sick will live in their communities with illness. We are not debating those policies. We are facing a moral choice. Are we going to be the kind of community that turns its back on our neighbors, on our friends, on our family members who might one day be in need? This is our moment to choose. Let's come together and make sure that in Cuyahoga County, every child, every senior, every working family is fed and is cared for, that parents can get to work, and that every resident has a chance to live a life that is healthy and with dignity. It is with that I would like to introduce my colleague, Kevin Gowan, to come forward. And Kevin is going to have a presentation and share the facts about what is the law in Cuyahoga County.
now I get the clicker. All right. I just, as a precursor to all this, I seriously considered tripping up the stairs at the beginning to get my gaffe out of the way. So whatever my gaffe ends up being, I apologize. All right. But I am here to talk about the federal changes. And the first thing I'm going to say, it's in my bullets here, is I may not be and likely will not be able to answer all questions here today. There's a lot that still has to unfold regarding these rules. All right. But they're significant enough, as everyone here has said today. And thank you from Chantal Brown's office, Jasmine, David, Chris, Claire, and Yvonne for all coming up here to talk about what's happening. This is a very serious topic, and we're concerned about what's going to happen here. So what are we talking about? The major changes are to the SNAP and Medicaid programs that we're talking about today. They were passed on July 4th as part of House Resolution 1, or as they have come to call it, the One Big Beautiful Bill Act. Okay. We're still working to understand it all, as I had mentioned already. The information we're providing you today is good as of today. We will continue to share information with everybody in this room and with the public on these changes as it develops and as the rules become permanent. Okay. But the official rules regarding these changes, the details that tell my staff how to do their job, haven't been written yet by FNS for SNAP, that's the Food Nutrition Service at the federal level, and CMS, or the Center for Medicare and Medicaid Services for Medicaid. Before I jump into that, though, I'd like to talk a little bit about who we serve. Starting with Medicaid, there are about 380,000 residents on Medicaid in Cuyahoga County. This represents approximately 1 in 3 residents. More than half of the children 18 and younger in Cuyahoga County are covered by Medicaid. And about 1 in 5 seniors in Cuyahoga County receive Medicaid to assist them in paying for their Medicare costs. For SNAP, there are over 190,000 residents in Cuyahoga County who receive SNAP benefits. Of those recipients, 39% are children under 18 and 14% are seniors 65 and older. So the majority, over half of our population, are seniors and children. The first thing I'm going to talk about, and I really want to get to the panel, so I'm going to move along with these rules, is with regards to the changes to the SNAP program, and then we'll move into Medicaid. First off, the new law expands the definition of able-bodied adults without dependents, who are required to be enrolled in a work activity to be eligible or to continue to be eligible for SNAP. These previous work requirements that have been in place for years cover ABODs, these able-bodied adults without dependents, who are aged 18 to 54. Under the new law, it will add requirements for adults ages 55 to 64, significantly increasing the number of people who have work requirements in front of them. They can meet exemptions. If they don't meet the exemptions, they're part of this population. But currently, that's an additional 17,000 residents who will be deemed ABODs as part of that population. We have a significant population of seniors who are receiving SNAP benefits. For reference sake, just so you understand, there are about 3,000 people who cover the 18 to 54 range right now who are ABODs. So this is more than a 5-fold increase on the age alone. It also adds work requirements for parents whose children are all age 14 or older. This was new. And we're estimating that to impact about 8,000 people, 8,000 recipients in Cuyahoga County. One of the more troubling things right now is we don't know when this is going to affect. Technically, it was signed into law. It's effective when it's signed into law, but we don't know the rules yet. So we're waiting for an effective date from the federal government, which we don't know when to expect it, but we know that it's coming in. We know that the SNAP changes, these SNAP changes in particular, are going to be the first things that hit. And there are multiple dates around all of these changes, but these SNAP changes I'm talking about right now, we don't have the date yet. We just know they're probably going to drop first. There are some other changes to the work requirements. Okay. Previously, under current rule, veterans, homeless individuals, and youth who have aged out of foster care are exempt from the work requirements. That exemption is going away. And that covers about 1,500 recipients now in our population. Okay. The bulk of those people are deemed homeless. That's roughly 90% of that population, of those 1,500 people. The individuals may still meet an exemption due to being mentally or physically unfit for employment, but normally they need to prove that. They need to have some sort of verification that they cannot work. And again, this hasn't been, we know that it's signed into law, but we don't have an effective date yet. Okay. Funding changes. So the federal government traditionally has paid for 50% of SNAP administration. So the money we need to run the program has been covered 50% by the federal government. That is changing. They're reducing that by half. That funding pays for staff salaries, it pays for computer lines, it pays for phones, it pays for everything we do to do our job. Okay. This, we do have an effective date on, that is effective October 1st of 2006. The other potentially larger hit to the budget, hit to funding, is that currently and traditionally and historically throughout the program, SNAP benefits are 100% federal money. So if a family gets $500 a month, that's federal money. That changes with this new rule. The federal government, the states will now be fiscally responsible for up to 15% of those benefits. It's a very significant change, and it's on a sliding scale based on the error rate, the statewide error rate. If you're really interested after the show, we can talk about how our error rates are gotten to. It's a little too deep into the weeds for now. Okay. But for perspective, $3.2 billion went out in SNAP for the state of Ohio in 2024. If the maximum allotment or the maximum responsibility for the state were to be in effect, that would have been $480 million that the state would be on the hook for. That is more money than they pay on the SNAP program altogether right now. The state of Ohio pays for the SNAP program right now. It is a significant hit. And Cuyahoga County was roughly $430 million in SNAP benefits. Now I'm going to talk about the changes to Medicaid. Work requirements are the first and most important thing regarding Medicaid. For the first time in the history that we've administered the program, there are work requirements for Medicaid. These will be imposed on customers from the expansion group. And for those who don't know what I mean when they say the expansion group, those are the individuals generally ages 19 to 64, who became eligible for Medicaid with the passage of the Affordable Care Act and when Ohio opted in to be an expansion state. In Cuyahoga County, it's roughly 98,000 people. These are June numbers, by the way. Okay. Currently, there is no work requirement, and under the new rule, the expansion population will be required to work 80 hours per month or any other community service or work program or paid employment, or they must earn the monthly equivalent of the federal minimum wage times 80 hours. Just telling you what we know as now. The other change for the expansion population is they have a shorter certification period. Right now, individuals who sign up for Medicaid are good for a year. After a year, they need to renew. Under the new rule, this expansion population has to renew every 6 months. These changes have to be effective with a little bit of a sliding effective date. The legislation says that these rules have to be in place by the end of next year, December 31st of 2026. Okay. There are also changes to the retroactive eligibility period. Pardon me. There's my gaffe. Medicaid applicants may be eligible currently, right, to have their past bills paid by Medicaid 3 months prior to their application. So there's a retroactive eligibility period. You apply today. We could be looking back all the way back to June to potentially cover you. Okay. That is changing. For the expansion population, it's only 1 month that retroactive eligibility will be in place. And for all other Medicaid categories, it's being reduced to 2 months. Thank you. I got a wow in the back, so it's a significant change. There's also the adding that the states have been directed to update their plans to allow co-pays of up to $35 per service for all expansion again, the expansion population. Most of the Medicaid changes, if not all, have to do with the expansion population. The states are required to amend the plans by October 1st of 2028. So changes that affect both programs have to do with citizenship. To be eligible for SNAP and Medicaid under the new rules, you must be in one of these categories: U.S. citizen, U.S. national, a lawful permanent resident, people who possess their green cards for the most part, after 5 years of being a lawful permanent resident. There's small carve-out exceptions for granted Cuban and Haitian entrants, compacts of free association, Federal United States of Micronesia, Republic of the Marshall Islands, and Republic of Palau. What this effectively does is legal immigrants are no longer eligible for these benefits unless they fit within these categories. For perspective, we have roughly in Cuyahoga County 9,000 legal immigrants. Some of them will keep their benefits because they become lawful permanent residents, because they meet one of these categories. We estimate approximately 4,000 will lose their benefits. We don't know when this is going in place for FNS because it is supposed to be effective when it was written, but the final detailed rules have not been written. And Medicaid, this takes effect in October 1st of next year, of 2026. Every time a customer, I'm sorry, so why are we telling you this? What is our primary concern? Actually, it's this. It's churn. Every time a customer comes to us to renew when they're required to complete something, paperwork, work requirements, any piece of administrative work that the customer needs to do, there's a chance that they're going to lose their benefits. There's just always a chance they're going to lose their benefits. What we've done looking at the numbers in the SNAP program, which has a lot more check-ins than and currently has a small bit of work requirements for the population, 1 in 3 of those interactions result in the individuals losing failing to complete and losing their benefits at least temporarily. The vast majority of those people are reinstated within a 4-month period. But it's important to note, reinstating is actually more work for the client, and it's more work for the agency than simply if someone had submitted everything timely and we're able to go through our standard process, the reinstatements take longer, which means there's less time to devote to timely clients, to new clients, as we go through the reinstatement process for people. This is one of our biggest concerns, if not our primary concern, with the introduction of shorter certification periods for Medicaid, work requirements in both expansion and SNAP, and the new introduction of work requirements in Medicaid. It's going to increase churn. All right. And I'm going to move now. We'd ask to save questions to the end. They have a mic at the table, so I get to answer too. But I'm going to pass this off to Emily Campbell from the Center for Community Solutions, President and CEO. And she's going to lead a panel discussion about the potential impacts in Cuyahoga County. So thank you.
All right. Well, now that Kevin has shared what is coming and what is happening, we get to shift gears a little bit to talk about what are we going to do about it. So to get started, and before I introduce the panel, a couple of key points, since I have the microphone and the clicker. I think the first and most important thing to keep in mind is that these are not decisions that are being made in Cuyahoga County. These changes are policy changes that are being done to our community. We're not choosing this, but we can choose how we respond. And to be clear, this federal policy is not good policy. It's complex, it's expensive, and it's explicitly designed to remove people from these programs. There is a legislative and advocacy conversation to have. We were teed up a little bit about that, but that's not what today is about. Today is about how we take these changes and look forward to figure out how to collaborate, how to have a conversation, and how we can help each other within our community. I will commend Cuyahoga County for their willingness to share what they know, when they know it, as soon as they know it, and help us all figure out how we navigate these changing audiences and these changing waters. And also thank you so much to the panel today, which represents many deep partnerships within our community and many more to come. So one thing I want to emphasize as we move into the panel discussion, as Director Gowan indicated, Nothing has changed as of today. We are waiting, as the rest of the country is, for those rules that will go into immediate effect for the SNAP program. And we have a little bit of a runway in terms of the changes coming to the Medicaid program. So what we're trying to do is get prepared. We have a little bit of notice, and what can we do to get prepared? And we know this will happen any day now. So with that, let's turn over to the panel. We'll have a little bit of time where I get to ask questions and tee up the discussion, and then leave quite a bit of time at the end for whatever questions you may have. One thing I want to note in that, as you're sort of thinking through the implications of all of this, is that there are folks that are here from Cuyahoga County. If you have specific questions related to your family or your particular circumstance, they'll be able to answer those individual questions kind of separately and privately. All right, so moving on to the distinguished panel, and they're all seated in alphabetical order, which makes it easy. First, we have Ramona Brazil, Executive Director of Government and Community Relations for Metro Health. Devin Hickman, Cleveland Site Director for Center for Employment Opportunities. Patrick Kearns, Executive Director of Resource Cleveland. Cheryl Pritchard, Community Advocate, here today representing Noble. I see some of her Noble friends here at the table too. And Kristen Morzoka, President and CEO of the Greater Cleveland Food Bank. And I always think it's weird when we have our faces in person and our faces on the screen. So we're going to just go past that. So Cheryl, you're here next to me, and my first question will go to you. And then before that, though, let's for all the panelists, if you could share a bit more about yourself and how these coming changes will impact our community and the people that you serve. Do you want to start, or should we start on with Kristen? Kristen, we'll make you go first.
Oh, all right. Thank you. Good evening. Can you hear me in the back? The microphone is on? All right. Well, my name is Kristen Morzoka. It's a pleasure to be here tonight. Thanks, Emily, and thanks to the county, Cuyahoga County, for hosting this. Can't hear you. Oh, sorry. I need some training. Can you hear me now? Ooh. All right. Let me try that again.
Somebody always has to be muted these days.
Someone has to go first. I'm Kristen Morzoka, President and CEO of the Greater Cleveland Food Bank. Thank you, Emily. Thank you, County Executive Chris Ronayne. Thank you, Councilwoman Conwell, and thanks to everyone from the county who has helped hosting this very important conversation. I've been at the food bank for 25 years this week. And for 25 years, we've been talking about the importance of the SNAP program and how for every one meal provided by a food bank nationwide, 9 meals are provided by SNAP. And what that means is that when there are changes to the program, even changes that feel very small, they can have a large impact. And it's so important that we're able to get the word out to people who need SNAP when changes are coming. And so I think this is a nice opportunity to do that. One of my biggest concerns is just confusion. These changes can be complicated. A lot of people may not realize that they're going to be eligible or required to meet the work requirements for the first time. And so I think that being strong communicators, all of us together, is going to be critical. I expect that we're going to get a lot of calls in our help center, and Logan, the manager of our help center, is here, and Lisa, the manager of our outreach team, is here. And we can help answer a lot of questions at the food bank, and working closely with Cuyahoga County and the other counties we serve, we intend to. So thanks for the opportunity.
Thank you. Cheryl, same question to you. A little bit more about yourself and how these coming changes will impact our community.
Hello, everyone. I'm Cheryl Pritchard. I'm a community advocate. I'm the founder of Planning Positive Seats and Retention 216, and I am on the steering committee for Noble, as well as I'm a partner of several other community organizations. My biggest concern is, as a person who, once we're going between jobs, I resigned from my position at work back in May. And since that time, I have gone through the ringer trying to secure my own Medicaid or secure any type of insurance that I might need to help me. In fact, I haven't even been able to go to the doctor, even though I was told that I have 3 insurances now, right? So those are my concerns, exactly what Emily? I'm sorry, what Kristen said. is getting the information to the people. There are a lot of organizations out here that are navigating different organizations, different resources to the community. I think, unfortunately, I think that this is something that they're going to have to add to their plate, right? Instead of, everybody doesn't go to the food bank. Everybody might not go to a lot of the other organizations here. And that's the same thing with SNAP. I have someone, only reason that they knew that they were eligible for SNAP is because they just received Section 8. And somebody in the Section 8 department told them, hey, are you getting your SNAP? Right? So if we're not sharing this information across organizations and just giving this information out without someone having to ask about it, I think that's my biggest concern, and that's where I'm afraid. Because I've been off work since May. I don't receive SNAP. I just got today I was on the phone for over an hour on my way here just to prove a point of how difficult it is to get your insurance situated, right? That's someone's lunch break if they're working part-time or something like that. So when are they going to have the time to do what I had the time to do today?
Thank you. Patrick, a little bit more about yourself and how these coming changes will impact the people you serve.
Sure. Thank you, Emily, and thank you for the invitation tonight to be here. So my name is Patrick Kearns. I work with Resource Cleveland. I've been the executive director for 9 years now, and we serve newcomers, international newcomers in Cuyahoga County. We're a multi-service agency that every year works with about 2,000 to this year probably over 3,000 individuals. What I'm concerned about, I have quite a few concerns. And what I think it's important to understand is when we talk about SNAP and the changes to Medicaid tonight, this is part of a regime of changes that is targeted at our newcomer immigrant populations. There's changing or cancellation of status, legal status on their immigration. There's regulations around work permits and driving licenses that have just changed. There's increased wait times and wait periods for green cards. And all of the above have increased fee structures for families that are literally just arriving, often from conflict zones, trying to start their lives from zero again. So disproportionately, our folks have higher levels of SNAP enrollment rates because they are literally starting from zero in their first months and years here. I can't underscore enough what Kevin said about the changes on the eligibility, because the change in eligibility affects legal immigrants who are here that are eligible for green cards. But part of that regime of changes we're talking about has meant the slowing down of the green card application processing. And so we could see as an effective date, thousands of individuals, hundreds of families lose these SNAP benefits that they're eligible for, even though they are lawful permanent residents that are scheduled for a green card application. That is something we're really concerned about, and it's going to require a lot of strategic thinking. The other thing that I think is really critical to understand when we talk about newcomer populations is the administrative churn. The newcomers have language and cultural barriers to access things that are becoming increasingly bureaucratic and complicated to process. That wait time and those delays will disproportionately affect people that do not have English as their first language, that maybe have recently got their first cell phone, that are not as digitally fluent as many of us. So these are some of the coming things that we can foresee, and that is really going to take, as we've been talking about, a lot of heads around the table to address.
Thank you. Devin, your turn. How will these coming changes impact our community and the people that you serve?
Thank you, Emily. And thank you very much. And thank you for everyone who put this together. Truly appreciate having the opportunity to be at the table as we start this journey. My name is Devin Hickman. I am the director of the Center for Employment Opportunities. I also serve as the chair of Economic and Workforce Development for Cuyahoga County Office of Reentry. So when I think about the individuals that we serve, which is the justice involved population, so the moms and dads, the sons and daughters that have been involved with the criminal justice system that face collateral consequences that make it very difficult for them to rebuild a life, I think about all the barriers that this creates. But more importantly, I think about equity. Being able to find a job that they're proud to have, that they can now take care of their family and live the life that they want to live. Those are some things that all of these changes are going to drastically impact. In addition to that, when someone re-enters society from prison, they start at zero, just like some of our newcomers. So their access and their ability to some of these benefits drastically impact their ability to get there, to make the change that they want to see. The reality of it is that, and so before I came to the Center for Employment Opportunities, I spent a lot of time in health equity. And we operate off Maslow's hierarchy of needs. And so as I work in the workforce space now, what good is a job if I don't have a place to sleep? What good is a job if I don't have food? What good is my job if I'm not safe where I live? So those are some of the key worries that I believe present themselves with some of these changes. Thank you.
Thank you. All right, and moving down to this end of the table, Ramona, how will these coming changes impact the community and the people that you serve and the institution that you represent tonight?
Yes, thank you very much. And again, also thank you for hosting this forum. This certainly needs to be the first of many conversations that we dedicate ourselves to having as these changes continue to roll out. My name is Ramona Brazil. I am Executive Director of Government and Community Relations at Metro Health. I'm a registered nurse by background. I've been a nurse for 25 years. Also worked in public health for 20 of those years. So certainly bringing that perspective to this particular conversation and how the hospital system partners with our local government officials as well as our community on how we work together for health. I think it's probably apropos that I went last because what we know is so many different things actually contribute to health overall, including food insecurity, as well as economic opportunities, housing, education, how they all fit together. So certainly at Metro Health, we have served as this county's safety net hospital for almost 190 years. Our core mission has always been to take care of everyone regardless of their circumstance. And we're in a situation where that is increasingly difficult already based on the very expensive nature of providing healthcare. We've certainly seen an increase in labor costs and drug costs and supply costs over the last few years. We've seen increases in uninsured patients over the last few years with some different provisions where people have lost their insurance. We certainly need to pay attention to what's happening with the economy as more people lose their jobs, they become uninsured. And so as we've seen, and I don't know, our news is very quiet. No, it's not. It's every day, but certainly that we have seen a dramatic increase in the number of uninsured patients that we've been taking care of over the last few years, and our charity costs have exploded to a level where we certainly feel like it's not sustainable. And so some of what we are working on now is how do we work with those folks who are currently uninsured to get them on insurance. So part of it is that we can't be afraid of what's coming, that we have to prepare and act now. We are approaching approximately 1 in 10 of our patients are uninsured. And while it certainly is the responsibility of all hospital systems in our area to provide charity care as the system's public safety net hospital, we take care of a disproportionately higher number or higher percentage of patients without insurance. We take care of a disproportionately higher percentage of patients with Medicaid. So that means that there's a smaller percentage who have private and commercial insurance, and therefore there's not as much room or to absorb the costs of taking care of uninsured people. So that is certainly before these changes come into place. So we are concerned that as these changes come into place, that will only exacerbate or worsen that situation. So it's very important, as has been noted, that we work together, that we understand what changes are coming and who is going to be impacted, and that we look at what our current options are in making sure that as many people who need coverage get coverage now. And we've certainly been talking to lots of folks, our community partners and stakeholders, the county, the city, because we believe that a concerted community effort is needed to do so.
Thank you. All right, now heading back to Cheryl. We heard from Director Gowan a lot of important technical information, have heard the importance of messages and sharing information. What support or information do you think would help residents who are receiving Medicaid or SNAP the most right now? What should we be sharing?
Well, you should be, for me right now, it seems to me that we already have a big problem getting the information out and sharing information with the public and, what's available to them. Because there's already been changes with SNAP and these other entities prior to what we're looking forward to, right? And so a lot of the community doesn't even know what they're eligible for already. They already don't know that who is the marketplace. What is that insurance? How does that affect me? If I'm working, do I pay? Is the marketplace, am I paying for insurance or is my insurance free? Am I getting Medicaid through the marketplace or what am I doing? There needs to be clarity. That's what I think right now, clarity.
Great, thank you. Shifting gears a little bit to Patrick, as we've heard, some groups are facing work requirements, but the ability of many non-citizens who are here legally, including refugees that our community has welcomed from Afghanistan and the Ukraine more recently, their ability to access public benefits they previously qualified for is disappearing completely. How is your organization and others who work with particularly impacted groups responding? And then a second, maybe more difficult part of the question is, are nonprofits equipped to absorb increased demand for services as some of these federally funded programs become constricted?
Sure. Thanks, Emily. And, while we're seeing a restriction in some of the federally funded programs and services to residents, we are also seeing a restriction and a radical decrease in federal funding that has gone to the organizations that historically have supported immigrants and newcomers. So while we're seeing this rise in demand, we're also seeing some of the budget and funding pipelines that have historically been there be hollowed out. That presents a real issue and it presents a real struggle that we're all going to have to work towards. And it means we have to think differently. So what are we going to do about it? What are other organizations that are in our sector going to do about it? The first thing I think is we need to double down on investing in proximity. And without proximity, there is little we can do to move forward. And what I mean by that is over the past 25 years, I've been working in direct services. It's always easier to address a problem before it metastasizes, right? It's always easier to address a late rent bill as opposed to an eviction notice. It's always easier to find out about a cold and a cough before it's something more serious. And proximity is what gets us to that point. About a month ago now, we hosted the first town hall for refugee newcomers in the city of East Cleveland. And that night, 40 families showed up. And to a family, they said there's between 100 and 150 families of Congolese newcomers living in the city of East Cleveland, many of whom have moved here from other cities and bought houses. Most of these families are unaware of the news coming on what's happening in Cuyahoga County. They're unaware of these changes. They're struggling already to access these services. So one thing that we are doing is we're committed to moving and expanding resources and staff to that area to serve these individuals and these families so that they can try to make this new American life work for them, even under these dire considerations. So that investing in proximity through office space, through staff, through being in the community, through holding pop-up events is the first pillar, I think, of what we need to do together to address this. And the second is we need to think differently about coalitions. I don't know about, if you're a nonprofit person in this room, you're probably a part of 5 to 10 different coalitions at any given time. And there's coalitions that talk and there's coalitions that walk. And I think we need to be a little bit more on the front side of coalitions that walk. We need to have coalitions that take risk, that understand the urgency of these situations and the urgency of now and what's coming towards us, and that can work and think differently together about how we are actually out in the community and we are investing in those touch points with real people that we serve. And, you know, that's going to take work. I think we have the right people in Cuyahoga County to do it. I mean, goodness knows we have the right leadership. And I think it's really what we need to continue to invest upon.
Thank you. That leads me right to my next question, which is for Kristen, and it's about partnership. The Greater Cleveland Food Bank works with lots of partners across multiple sectors to help thousands of neighbors. Two-part question: what have you seen or learned from past policy changes impacting SNAP that we might be able to apply to what's coming today? And what partnerships can be leveraged to support the Greater Cleveland Food Bank and residents whose hunger assistance might be lost or reduced because of these changes?
Thanks, Emily. So over the years, what we've learned from watching other policy changes and responding to other policy changes is that the more resources are available, and that resource could come in the form of a good paying job, affordable housing, increased benefits, the less demand there is for emergency food. And I would use as an example one that was brought up earlier by our county executive, which was during COVID. You know, at the very beginning of COVID, so many people lost their jobs at the same time. And we immediately saw just a skyrocketing need for emergency food. But then over time, a number of things started to happen. Extra unemployment was available. People went back to work. Extra benefits became available. A lot of people on SNAP were able to receive the maximum allotment for a family their size. There were child tax credits, right? Stimulus checks. And after we saw any of those benefits hit, like a child tax credit, we saw immediately the need decrease. And so these things are absolutely related. You know, when someone has money in their pocket, they go to the grocery store first. When they run out of their SNAP benefit, right, they spend SNAP first and then also often end up at a food pantry at the end of the month as they're trying to make ends meet. And so I think making sure that everyone understands the total resources available will be critical. We often do that in partnership. We have a help center where neighbors in need of food can call, and we can connect them to one of our 1,000 partner programs across our 6-county service area. We have an outreach team, which is helping connect people to other nonprofit partners to address some of these underlying issues of food insecurity, whether it's trying to help someone connect to a great job training program, like some of the training programs here at Tri-C, or a job placement organization, or more affordable housing. And we also have a community resource center where we have 17 nonprofits co-located and collaborating to not only provide food in a market style shopping experience where the food is free for anyone 200% of poverty or below, but we have all these other partners on site. And so, you know, these are partners that are really important to us because we know that we can serve the community better when we're working in collaboration. And I think that that's what this is going to take, even more collaboration.
Thank you. Heading toward Ramona now. You know, we heard that we have a runway before the Medicaid work requirements go into effect. But one of the things that you said resonated with me is that we can't be afraid of what's coming. We have to act now. So what should institutions and communities be doing now to prepare? And how can we come together across multi-sector systems in partnership to mitigate harm?
Thank you very much for that question. Certainly, you know, that we want people to understand what are your options right now. You know, for some folks, where that might be that they've not taken advantage of employer-sponsored benefits and insurance. We certainly are in enrollment time soon. We also, of course, you can always apply for Medicaid and Medicare, but you know, we're really going to push this last quarter to get those who are uninsured signed up for the marketplace. Now, we know that there are some potential changes coming to the marketplace as well, but they're not here yet. So we're going to use the tools that we have. We have approximately 40,000 uninsured patients at this point, and some of those patients could benefit from plans in the marketplace. So part of what we have to do is a lot of intensive outreach. You know, we were talking before, I was talking to Sabrina right before from the county, right before this, we're talking a ground game. You know, and it does remind me of COVID. And I was at the health department at the time during COVID, and the food bank certainly was one of our best partners. But we have to reach people where they are. And that is beyond phone calls and websites, but in really working with partners to reach the people we need to reach. Because it is, I mean, we have to be honest, healthcare is difficult to navigate on a good day. You know, in healthcare and finances together can be virtually impossible, feel virtually impossible some days. And I think Cheryl gave us an example already. I think, you know, one thing I certainly don't want to be missed in talking about healthcare financing and economics is the impact of not having insurance. And what we need to be concerned about when we don't have people who seek preventive care. And when you get to know a primary care doctor who knows you, knows your family history, can say, you know, somebody in your family had a heart attack at 50. You know, we need to do this. Or your blood pressure is a little high. We need you to do that. Or we need to give you this medication. Versus showing up in the emergency room department with a heart attack or a stroke. Or instead of a cancer screening, a late diagnosis cancer screening. So we're talking about that it's not just the cost, the money, the economic cost, it's the human cost. And that, and when we delay care, it's more expensive. The emergency department is the most expensive way to get care. And if you have a later diagnosis, it's gonna be more expensive to treat. But also that the health outcomes are not as good. So we have more expense, worse health outcomes. In a county where we've been trying really hard to work on a lot of really hard things, like infant mortality, maternal mortality, cardiovascular health. These are hard things to really accomplish, and these types of things makes it more difficult to address those and to remedy those, so for the public's health. So even if you're not personally impacted by the changes, that these type of changes is not good for the public's health. And that's why it requires a community effort to band together to help all of us, for everyone.
Great, thank you. So Devin, you know, part of what we're talking about today are work requirements, that more people are going to be subject to work requirements in order to get or keep the benefits that they would otherwise qualify for. And probably the most straightforward way to meet work requirements is paid employment. What are some of the challenges and opportunities facing workforce development in this moment, recognizing that many of the people who will be subject to work requirements have other barriers to employment?
Thank you, Emily. And so I think a lot of us have already mentioned some of those barriers, whether it's childcare challenges, reliable transportation, housing instability, limited digital skills, or even gaps in education and training. In addition to health concerns or having a criminal record, the challenges for workforce development is that we can't just focus on getting people any job. We need to create pathways to sustainable employment that actually lead to stability. That means aligning training programs with the real needs of local employers, removing barriers by connecting people to wraparound supports like childcare, transportation, and making sure that people with lived experience are also a part of the solution. The opportunity I see right now is that workforce development is being not just seen as an economic issue, but also as a community well-being issue. Employers are recognizing the need for a broader talent pool, and that creates space for innovative partnerships between workforce programs, social service providers, and the government.
Devin, can you slow a little bit for our interpreter?
I'm sorry, I forgot.
So our interpreter can catch up. Sorry to interrupt you. You were on a roll.
All right, no problem. So again, I was speaking to the opportunity. The opportunity right now is that we can all be intentional about how we work together to build actual pipelines. And some of this work is already happening. I've seen it during the time I've been working with Cuyahoga County Office of Reentry about getting people connected to the resources that they need that get them into jobs that create economic mobility. Give them the opportunity to make a sustainable living, not just one that gets them through, but one that they can thrive on. That is our call to action. Our call to action now is to take all of these resources that we have here, because we are resource rich in Cuyahoga County. Almost says something, but we are resource rich in Cuyahoga County, but we have an opportunity to be better with our processes, more intentional with our partnerships, but also to make sure that we remove, so like we can all turn our name tags around right now, because that doesn't matter. It doesn't matter what our organization's name is or how long we've been around. What matters is that we are a collective, and we are going to need to be a collective to be effective. And while I work with the justice involved population, I work with one of the populations that it is the hardest to not only get into training and development programs, because there are stipulations based on your background, but also to find equitable jobs. And so what this is going to do is this is going to make it difficult for everyone to find equitable jobs, because there will be individuals who have to just get a job. And just getting that job doesn't mean that's a job that helps them take care of their family. It doesn't mean that's a job that helps them continue to pay their bills, but it also means that getting that job is going to reduce the benefits they receive. So their quality of life overall could be reduced. So creating more opportunities for every citizen to grow, develop, and contribute is what it's going to take, in partnership with great workforce development organizations, which we have a ton of in Cuyahoga County.
We need to be a collective to be effective. That's great. So tossing it up to all our panelists before we shift and hear some of your questions from the audience, for just a couple of you, from your perspective, what does a successful response to these challenges look like? Who wants to go first? Sure, please.
I think that what Devin said was spot on, right? Success looks like having a job that I'm proud of. Success looks like making sure that my family can eat. Success looks like from an organization, because I do, like I said, work with, I am a 501c3 and I work with several others. It's actually taking what we do and allowing us and helping us to do it well, right? And one of my partners just said on my way here, they said, sure, you know, I just got this little grant, but I don't even want to take it because I know I might not be able to do it well, what it is that she put in for the grant at this time, right? So we need to be able to, we need to be open-minded and stop looking at the different silos that we have and picking and choosing who we want to work with. We have to open up the gates and allow other people in who want to actually do that work, not just who you think can do it, because a lot of organizations are able to help. Even with Metro Health, these are jobs. Trying navigators, these are jobs. Helping people get their insurance, helping someone get their SNAP benefit. It's more than just a phone call. It's more, you know, it's case management. It's actually wraparound services. What does that really look like instead of just talking about it? And there are organizations, like you said, we are tons of organizations in our community that are able to do everything. There needs to be certain funds set aside in the budget that can allow these things to happen. You know, if the Browns can do it, why can't people have insurance? That's what I'll say.
Please.
I think success in some ways looks like mitigation. If we look ahead, it looks like there's a couple serious waves coming at us. And I think success is making sure that those waves are not a tsunami, but something that's a bit more manageable. And I think that mitigation is really going to be looking at, again, that proximity issue of understanding when families are on the verge of being in crisis and how we can collectively pull support in. Because I worry about when especially young people, hit a point of family crisis, the decisions they begin to make. And they're probably not decisions that are going to be decisions that allow them to continue to thrive and take opportunities, but to get through the day. So, we are looking at changes that have a significant impact. So, I don't mean to be so doom and gloom, but I think successful management of these changes means a mitigation of the worst possible consequences.
And at least we won't be taken by surprise because we're talking about it now. All right. Any other final thoughts about what success looks like before we open it up? Please.
I just want to toss this out there because we talked about like what a real world example looks like. Just a quick question. How many people in the room have heard of the Case Comprehensive Cancer Center? Okay, so the Case Comprehensive Cancer Center
Case Comprehensive Cancer Center.
So that cancer center, it's the effort of Case Western Reserve, University Hospital, and Cleveland Clinic all coming together. They share patients, they share information, they share research, they share dollars. All in the name of curing cancer. All in the name of curing dis-ease. Poverty is dis-ease. Incarceration, reincarceration is dis-ease. Lack of essential needs is dis-ease. If those major organizations can come together to cure the dis-ease of cancer, then I think we can do the same thing when it comes to the resources and the organizations that we have in Cuyahoga County. So when we talk about what success looks like, it's right in front of us.
Thank you. All right, turning it to the audience, what questions do you have either for the panel, for me, or for those from Cuyahoga County? We have a couple of microphones. Oh, there's a microphone over at either side. If you have the ability, if you could,
You want me to MC? I'm good for something.
You'll always grab the mic, County Executive.
Here we go.
Hello, my name is Sharon Sullivan. I am a community health worker with the Village of Healing Center. And I thank you guys because what each of you described are the social determinants of health. What you described, a person cannot get better in life, period, without eliminating those barriers that you guys have been talking about. I get the privilege of being one of the people who help eliminate those barriers. I think that what we need to do, what needs to be done for us, is we need to be prepared by the county and the state, because this thing is going to be a tsunami, because the administrative churn is going to bottleneck, and it's going to be more than 1 out of 3 that's getting lost in the shuffle. And if you can only go back 1 month retro, but some of this paperwork is going to take longer than that, it's going to be really, really bad. So if the county and the state can start to train us in these fields that we're in on how to submit the paperwork directly to them, give us the applications for Medicaid, teach us how to process them, give us a person at the county or state level that we can pass those directly to, and we can eliminate what's going to be a really, really big problem. And I think that if they would do it simply by Zoom, with some Zoom classes going on, we'll show up. Thank you guys for listening.
Thank you. I think our county's probably ready to do that. I don't know about the state.
Anybody in the county want to comment on that? Thank you.
Yeah, I mean, I'll comment on the community health worker idea. It's a great idea. I think that I know we have the hub here in Cuyahoga County. There's several community health worker initiatives that are going on. I agree with you completely. It's something we have to strengthen, and we're going to look into it. So thank you very much.
Thank you. Okay.
We're going to take.
Sorry. My name is Heather Shorten. I am the executive director and founder of a small nonprofit organization called Pompe Alliance. And for the people in the room that do not know what Pompe is, it's a rare disorder. I have it, my brother has it. And in the United States, a rare disorder is considered a disorder that has less than 200,000 people with the diagnosis. And to show you how rare it is, it's a recessive trait. So both of my parents have that recessive trait. This meeting for us, this is my dad with me. This meeting for us is very timely. We are trying to plan a town hall to discuss this with our population. We would love to have, you talked about collaboration, and Cheryl, you talked about clarity, and I'm right here with that. The people in our community need clarity. We have one of the most expensive treatments in the country. On the low end, it's $1 million a year. For me, my infusions, I get biweekly infusions, it is over $200,000 a month. I'm very fortunate because I have really good insurance, but I know where I'm right here with you, Cheryl, and talking about how hard it is. It was a full-time job when I received this diagnosis. I'm a social worker, so I have the resources and I know how to process it. But a lot of the people in our community do not. A lot of the people in our community are going to be affected by these changes. And we have a nationwide reach. Actually, we have an international reach. But we serve any Pompe patient or family in the United States. If they need it, we give it to them. During COVID, we provided food to a lot of patients because we could process that stuff in 24 hours, where the larger organizations, it could take weeks. We're here. We want to be involved. We want to be able to help our community. And the town hall we're getting ready to do, we're trying to do it next month. We are inviting anybody in the rare disease space. So any rare disease patient, and there are right now 10,000 identified rare diseases. This has a very large reach for the people in the United States. So we would love to talk to anybody who would like to help us out.
Wonderful. I'm sure those in the room on the panel or from Cuyahoga County have the information to be able to share the latest, most up-to-date, most accurate information with your group,
Yeah,
right?
and I'll just say, I think the town hall ideas are great. And to the lady that said earlier about bringing together the Medicaid forms, we at least can get you information about where to get those processed. Right, guys? Okay.
Hello, my name is Cassandra Washington. I'm an insurance agent, so I help folks with Marketplace, Medicare, and Medicaid. I have a large group of people that lie in that area that have both Medicare and Medicaid, and there's not a lot of conversation about how they're going to be impacted. Can we talk about how Next Gen is going to affect those people?
Sure, that's almost a topic for a different forum.
If there is one, can we know when that will be?
That's right. You know, just to kind of quickly answer that, I'm looking at the panel to see if any of you know, one of the things about the people that are relying on both Medicare and Medicaid is that depending on their age, work requirements may impact them for the first time. And so it is part of that, 55 to 64-year-old group that suddenly may have work requirements. But yeah, a lot of changes happening in that space too with the Ohio Department of Medicaid and others. Thanks.
I'm not sure there is anyone here who can answer my question, but I'm concerned about nursing homes and the Medicaid patients in nursing homes. And I'm concerned about the nursing homes themselves and how many are going to go out of business.
Yeah, I don't know that any of us have answers to that question, but something that we certainly can speak to.
I can't necessarily answer the question, but I will say that Cuyahoga County has by far the largest nursing home contingent population in the state of Ohio. And our long-term care team is, we've invested a significant amount of time in our long-term care team to help out with the nursing homes, and recently have actually increased the staff around that It's a concern for us moving forward because, as we mentioned at the beginning of the program, not all the rules are written yet. So we're not really clear on how negatively it'll impact the nursing homes, but it's on our list, and we're very concerned about that as well. And we're really beefing up our long-term care team in order to deal with those issues. I couldn't hear the question. Go ahead.
Yeah, so appreciate the question on including someone if there's another forum. And I think that's a good idea if we repeat the questions just so folks that are watching at home understand the questions as well. We will have other forums. Kevin does an outstanding job engaging providers. He actually has regular meetings with providers to talk through the changes that are much more detail oriented. And the long-term care group is one of the main groups that we talk to. So there will be forums that really speak to that population. Thank you.
Hi, my name is Sherelle Johnson. I'm with Cuyahoga Metropolitan Housing Authority. I'm an eligibility recertification specialist, and I work with the majority of y'all clients. I see them face to face every day. I recertify their leases. My question is, I talk to them all the time and ask them, how are your SNAP benefits? How is your TANF? How is your child care? Social Security. I ask them this, and the majority of them tell me, oh, I'm on hold too long, or I can't hold on. We have a high mental health population with CMHA. So my thing is that I would like to know if the county can get with the executives of CMHA to be able to collaborate to bring awareness and access on site, because we are on site with them at their houses, at their apartments, at their townhomes, on site with these residents where we see them face to face all the time when we renew their leases month to month. So I'm thinking if there could be something done to where we can all come together, because we have some of y'all largest client population, CMHA, and they need to know, and a lot of them are lost on how to get certain benefits and how to get their applications renewed. A lot of them lose their benefits because they don't want to wait on hold. And like Mr. Gowan said, he sees that there are going to be a lot of people who lose their benefits. Is there something that can be done with the county and CMHA where y'all can come together and we can work together to bridge this gap to educate the clients and keep them up to date with their benefit services?
I believe this one's for me, right? So we actually have, and Aida's right here to my right here, we have an outreach team that works with partner organizations and come out and we do events. And so I would put you in touch with Aida. Maybe you can put us in touch with your executive in order to look through what collaboration we can do. I will honestly say one of the things that Aida's team does a great job of, and this speaks to the navigator question before, we do navigator training already. And we'd be happy to engage and do more navigator trainings, especially as we start to navigate this new landscape for us all.
Yeah, and I'll just add to that, we will absolutely meet with CMHA and your leadership team. You guys represent 50,000 people in our community and our residents, so we will. But I would say, as everybody's talking about town halls and things, to keep our staff running, but also have some mercy on them. The more we can group up, the better in these town halls. And yours will be, a big group because it's CMHA. But yes, let's meet with your director, and then let's get sort of a couple of regional meetings. Yep.
Well, and also I want to point to Kristen too down at the end, because you have a unique partnership as well with Cuyahoga County through your resource center.
We do. Thank you.
Oh, yeah.
We do. Thank you. I mean, one of the things that I have thought was great forward progress in the last couple of years in terms of our partnership with the county is that we now have county caseworkers on site at our community resource center. And so when we help someone apply for SNAP, we can help connect them to a caseworker on site so that they can do their interview, which increases the chances that their benefits will be approved. Now, we are a number of locations where the county now has caseworkers on site. And from what I see at the food bank and from what I hear, that seems to be a model that's working really well because those connections with caseworkers are vitally important.
Great, thank you. And just want to point out, since I have the microphone, that appreciate that so many of these questions and are suggestions and answers to some of the questions that we have about how can we respond, but to recognize that Cuyahoga County is also very stressed and stretched in terms of their budget, the staff that they're able to do, and recognizing that, as was shared earlier, the administrative costs are going to be shared with an even greater percentage having to come from states and local governments. So we do what we can with what we have.
Hi, this is Lou. Good evening, everybody. For people who know me, you know I mostly represent a particular population in our society, the undesirables, the unhoused, homeless. Now I even would say refugees. The Medicaid and the SNAP, the reason we have all these changes, because the federal government, even our state government, they utilize lots of the research results favoring their theory. So I wish from this time on, we have the Center for the Community Solutions, Policy Matters of Ohio here, and also we have lots of medical professionals and even the housing, public housing authorities here. I wish all of you can collect the data starting now to show them their research is to fit their theory. It's not a reality. For example, I will tell you, sorry, I'm not good at sugarcoating anything. We know we will have lots of people lose their coverage. But for these people to reapply, the whole system has been designed to fail people. For example, state changed the system to the phone bank system instead of having the service like before COVID-19. We still have to encounter the situation that people have to stay on the phone for a long, long time to find out why their documents for recertification, they scan in, but still not received, still saying they are not in the system. County can make all the efforts, but state is the one to allocate the money to do all these work by design. If we do not collect our local data to show their data is not fitting the reality, it will be harder for all the organizations here to work. We have to use different angles as well. Thank you.
Thank you.
Hello, my name is Sandy Foster. I'm a former county employee, 35 years, and an interested citizen. My question is for Director Gowan. With the Medicaid changes, I know currently the proposed rules mainly affect able-bodied people that they are going to require to work. But I have kind of two parts to it. I think what's your effect do you think this will be on people in treatment programs? I believe a lot of people are covered under Medicaid that are in treatment. And do we see a bad effect with those folks who are trying to, become sober? And also, I was told that 80% of Medicaid dollars go to like 20% of the population, which would be your nursing home clients, long-term care, disabled people. If that's the case, it seems like even if you took everybody off expansion and everything, that if you don't touch people in those facilities, how are they going to possibly save all that money they're projecting? It doesn't seem realistic. So I just wonder if you worry about worse cuts coming down the pike once they realize it's not really going to save them whatever $800 billion. But just wondering, about treatment and about that.
So regarding treatment programs, which is the question I probably can't answer. The second question is a little more difficult. Regarding treatment programs, yes, at least written in the legislation, individuals in treatment programs as part of that, who are part of the expansion population, who have work requirements, being in the treatment program is in fact an exemption. So that you're not. So that again, the rules aren't written yet, but that is in the legislation. And so a lot of the exemptions we really need to see it in writing, but that's in there. That is in there. And in regards to the money numbers, I can only speak so much on that. Your comparison of 20% of the population gets 80% of the Medicaid funding. I couldn't answer that question. I just don't know. I just don't know. The actual payments out to the Medicaid providers occurs at the state level, not at the county level. So I can't really answer that question. But the expansion population, like I said, is 98,000 people in Cuyahoga County, which is trying to remember it's actually it's right around a quarter of the population that's on. It's a little less than a quarter of the population that's on. Pardon me, a little more than a quarter of the population that is on Medicaid now. And depending on how many people lose coverage as a result of that, yeah, it will drive savings. But to your point, yeah, long-term care is significantly more expensive than most people's medical expenses.
And I think this is a good place to be careful what we believe in terms of talking points that we hear. You know, we were told as this legislation was working its way through the federal system and through Congress that there wouldn't be any cuts to Medicaid and to SNAP. Well, the math doesn't math. There's no way to do that, to have the savings that some folks are looking for. And I know Congresswoman Brown and others were very vocal in that as these policy debates were happening. And so, you know, there is an element here for those of us voters and citizens and others to hold our elected leaders who have made these decisions accountable for some of the things that they've tried to convince us of.
Good evening. My name is Naila Muhammad. I'm the manager of Community Health Initiatives at Neighborhood Leadership Institute. Our program services pregnant women and connects them to resources as well as addresses their barriers to care. So the loss of insurance definitely would be a barrier to care. And so, and kind of in correlation with what a couple of other people were speaking about is some form of partnership. I've heard that there are different hub locations. My team and I have discussed perhaps becoming that, you know, when we are organizationally prepared, or, you know, wanting to understand what that would look like. Would someone in our team be trained? Is there someone we got to talk to submit an application? Like what would that process look like?
I feel like Ramona, do you have?
So you're asking about coordination with community organizations, and they gave you the. This is the part where I have to admit
a hub
that my hearing's
location for job and family services.
Job and family services. I mean, I know there's different locations that have people stationed there. So I was just, you know, trying to be a part of the solution. We have moms that call us with the same issues, like, oh, I was on hold for the day, or, you know, whatever it is, and then pick up and they got to hang up. So in my mind, I'm like, well, how do we assist them with being able to be of some kind of support to them as an organization?
And largely those concerns, and I might turn to David on this one as well, those concerns are resource issues in terms of our ability to operate out of other sites with the volume of work that we have right now. We talk to 2,000 people a day just through the phones alone. And that's the majority of what people are, and we serve more people that way than any other way. And it's difficult for us to open yet another center. It's been a discussion, but it's a resource issue for the most part.
All I'd like to add is we think back to when Affordable Care Act was launched. We think back to, or as a lot of us called it, or some people called it, Obamacare. There were community navigators throughout the community. They went out, they tried to help people get on Medicaid. Those resources are not coming from the federal government, at least that we've seen, and I don't have any hope that they will. So what I think we'll need is organizations like Metro Health that has community health workers and many others that help residents learn how to support their neighbors to get onto Medicaid, to file a SNAP application. I think those models are present in our community. I don't know that they're getting as much utilization. I'll follow up with you, but I think it's a thought that has come from several people that this is a strategy our community needs to embrace more, and we have to look at to see how communities can help communities, how we can train residents, and how we can find our own solutions in our own backyards.
Yeah, and I'll just quickly add to that. I think it's a great point. We aspire to this. I look to you, Chris, about the Food Bank and the Community Resource Center as one hub of a lot of services. But I think our goal is to get people in front of people. And so out at our county libraries and city libraries and places like the food bank, we totally agree with you. We just got to figure out how to get the financing to get to that network plan.
Yeah, sure, please.
So certainly we've recognized that as a strategy that we think is very important. Even as as a representative of Metro Health, this is bigger than Metro Health. It's hitting us hard, and we're being honest about that. But this is bigger than us. And so we really do need a community level effort. And as we've been talking to different community stakeholder groups, we've been talking to the clergy, they're ready to go. I hear people in this room are ready to go too. But, part of what we discussed earlier is communication, clarity. How do we get people connected? How do we coordinate and organize? How do we galvanize in one effort? Is part of the challenge that is next, but it's doable because we've done it before. So certainly, I'd hear it in the room, and I know from our system that we want to be a part of a convening, a collective that wants to work on this.
Yeah, and on that point of being ready to go, we're ready to go, but we don't know where we're going quite yet because we don't have the regulations. And so the fact that Cuyahoga County came out and shared what they could share when they could share it, recognizing that there's so many unknowns, I think is an indication of the kind of information sharing that we hope to activate within our community to be able to have some concrete answers and share those out widely the moment that we receive them.
Yeah, my name is Diane Howard, and I'm one of the commissioners of CMAJ of Lakeview Terrace residents. I am a resident, concerned residents, and been fighting for years for all the CMAJ residents. Like the manager over there, residents need more education, where we have like an event like this now, more focus groups to be educated on what's going on with SNAP program, what's going on with Medicaid, or how to fill out or where to go to sign up for Medicaid, to sign up for better health care. This is what all CMAJ residents need. From where I live at, I was appointed 2 years ago by Mayor Bibbs as CMAJ commissioner. I'm wondering why. 2019, I was senior of the year for Lakeview Terrace. Wonder why. We need more people in each community to stand up and fight for low and poverty, especially public housing residents. We need more good managers to be understanding and listen to our residents. We need more groups like this. We did have the LAC, I'm gonna sit down because I'm a long talker. We did have local advisory council at Lakeview. I'm trying to get up more residents to build our LAC back up. It's hard.
That's right. And this sounds a lot like Noble and some of the work that Noble is doing.
Well, I'm one of the co-chairs in Noble.
Oh, well, see, you already know. That's why it sounds familiar. Thank you for all you do.
Been also I'm a precinct committee person for 8 years for Ward 7A now. It used to be
right.
So I do a lot. But this is what we need, more events like this. I want to try to see if I can get an event at Lakeview Terrace at our community center. They make movies down there. Why not have a
That's true.
platform to relate to?
Yeah.
This is what I'm going to do. On Wednesday is our commissioner board meeting at 8120, the main campus, on the 3rd floor. That's an executive room. No, our executive room is on the 3rd floor. 2nd floor is our executive, where we have our executive board meeting. If any one of you on the panels could come Wednesday at 3 o'clock, I sit on the executive board, and I introduce you to all our committees. 5 of us on the commissioner board. We have a new commissioner from the new mayor of East Cleveland, Barbara, I can't think of her last name, Barbara Thomas. She's a new commissioner. She's coming CMHA board. Robert Davis, he had resigned because they got a new mayor. I was appointed by Mayor Bibbs 2 years ago. Nadine Head is a commissioner for Carver Park or Heritage View. Used to be Garden Valley. The other one, Joe Black. He's was appointed by, Stu was appointed by Mike Polinsky, Councilman Mike Polinsky. That was Joe Black. And Stephanie was appointed by Mike Polinsky. So there's only two was appointed by councilmen. The other ones we was appointed by our mayors. So, but thank you for hearing.
Great. Thank you. Thank you for that. Okay, I think we have time for one more question.
Hello, I'm Jessica Collier. I am the Director of Operations at Thrive for Change, but I'm honestly just here as a community worker and someone that supports a lot of folks. I feel like this is bigger than anybody in this room, right? If anybody had any control at this point, they would have stopped this already. There's so much happening. None of us have any control over that. At what point are programs like the food banks program with JFS in jeopardy? I feel like it's still very underutilized, and just most folks don't seem to know that it's there and what it's supposed to be for. I talk about it a lot, but I mean, even in talking about it in the same spaces, I'm seeing that just so many people will post the same post, right? They can't get through, their documents aren't going in, they're getting hung up on all day on hold, days on hold. I mean, you hear this story, and this has been since COVID, and it's just picking up. So we know that's all gonna pick up as this happens. At what point do we have to worry about programs like yours? I'm not asking about expansion, I'm asking how long can we reasonably keep the really great thing that we have done?
At the Greater Cleveland Food Bank, we're going to keep providing as much food as we can to as many people we can for as long as we can. And I have confidence that our community is going to come together and help us do that. And I have confidence in our partnership with Cuyahoga County that we can work together to serve as many people as possible. And there's no doubt that we have challenges ahead. But I also think that we have a community who cares a lot. And having seen how we responded during the pandemic, I have confidence that we can do that again. And if everybody in this room comes together, I think there's a lot of good work that can be done.
Thank you. JFS program at the food bank.
I guess I would turn it to the county. I mean, I have a lot of confidence in our partnership and in what we do together at the food bank, and I sure hope it will continue. But I mean, perhaps this is a question for Kevin and Chris and David.
No, we intend on keeping that program, absolutely. That's something that it's been over, how long now? Is it close to 2 years?
Longer, I think.
Been, yeah.
As long as the Community Resource Center has been open. So almost 2 years, I guess.
It'll be 2 years in November, I think. And so, no, we have a commitment to stay there and continue to work with the food bank and their navigators, and don't have any intention of ending that program. We don't want to get too far ahead of ourselves in terms of the cuts.
We don't know.
Yeah, in terms of, I shouldn't say that, well, there are cuts to federal SNAP funding, and in terms of the, but a lot of the cut changes are really about restricting the population. And so, but no, we intend in doing that, and we're continuing to work to make sure that the funding stays in place. But others are going to have to step up. Absolutely.
Mm-hmm.
Hi, good afternoon. My name is Ryan. I work with the City of Cleveland Department of Aging. So my question is kind of more of a logistical one. We might not have the answer yet. So they're using the language of able-bodied people and saying they need to work, and the new age is up to 63. So how does one go about proving that they're not able-bodied? Is there like a form that they fill out so that they can continue to receive benefits without working? Because a lot of my individuals I work with are
it's a little, I'm sorry. It's a little more case by case than that. There's not necessarily a standard form that they complete. It's usually from a medical professional to the effect that they are unable to work.
So would that be something that they have completed and then bring to the county?
Yeah, as part of the application process, they would have to provide, if they are told they have work requirements and they say they don't have the ability to work, normally we require some level of documentation. And yeah, it's that straightforward, yes.
My name is Gail Long, and I'm a member of Noble. I was on a, what do you call them? One of those Zoom calls on Friday, and it was sponsored by the Center for Community Solutions and the Advocates for Ohio's Future. And all of the stuff that we've been talking today is focused on individuals who are going to be impacted. But there's one other part of that formula, and that is we've got to be lobbying the state of Ohio, because if Kevin Gowan's error rate goes up, the county's going to have to put more money in that they don't have into the program. And so I want to know, how can you gather us all here today so that when you need that help in Columbus, we're going to be ready to do it, and we're going to know what the messages are. And we're already doing it at Noble, but give us some specifics on this, because I would think that every one of us in this room is right there.
I'm just going to start and pass the mic. I told Gail Long on the way in, I love her. I'm going to tell her I love you again, but I love you. Hope you don't mind. Yeah. I just want to say, and I'm going to pass it to these guys. I think Emily's probably got something to say about that too. We are going to collect, and we do have all emails for those who gave them here. You're absolutely on point. We need the advocacy that starts right here in this room of people who care. We need you. Whoever said it, Lou, the way you said it about this stuff state, it's just rolling downhill on us, right? Federal government's rolling downhill. I'm happy to say, even as budget stretched as we are, we added JFS workers because we need them. We need them in these times, but I'll admit to you, we don't have enough. And so, you know, I'm not going to rant against the Cleveland Browns once again today, but yeah, whoever said that, I mean, where are our priorities, right? So we've got to band together as an advocacy group, I think in two ways. If you'll indulge us, you wouldn't be here if you don't care a heck of a lot. Right. One, we want to keep you alerted as we see what's happening. And as we get news, we want you to have that news as quick as we can get that to you. That's probably our comms department at HHS, and our comms team will be getting that out. And then two, we may need to turn around and just ask for your advocacy help downstate in Washington and anywhere else that they'll hear us. That's just a start. I don't know if you've got more to add, please.
I just want to thank you, Gail. I want to clarify a couple things regarding the error rate. Yes, and I mentioned that there's a sliding scale of how much the state has to pay for benefits based on the error rate. It is not clear to anyone at this point, unfortunately, who's going to end up footing the bill. It could be the state. It could be a state county funding issue. We don't know yet. So.
But you can't afford to lose a dime.
Right.
Yeah. And so just in 2024, regarding that issue, the error rate for Ohio was 9.01%. The error rate threshold is 6%. And people are like, well, why is it that hard? We have both errors caused by staff and errors caused by clients. And it doesn't matter why the error occurred. If someone neglected to share part of their income and therefore they received a little too much or even too little SNAP, it's considered an error. Okay, and the threshold is $57, by the way. If we receive $57 more or less than an audit determines that they should have, that's an error. And
oh, sorry, Kevin.
So at any rate, I also want to put it in perspective. I believe it's 43 states had higher than a 6% error rate in 2024. So it is actually very difficult to get below a 6% error rate. And that's a heavy concern for us. And it's a conversation that's occurring at the state level. We have different initiatives we're looking at to improve our error rate. But it is a statewide error rate. There is actually not a county error rate. They don't calculate that independently.
So one of the things that those folks who work directly with people who are applying for or receiving any of these programs is to make sure that the information that is provided to the county is correct. Because as Kevin mentioned, the error rate is both impacted by errors at the county, but also by errors by consumers and clients as well. It all gets counted.
Yeah, I want to say one thing on error rates. Chris Ronayne and County Council, sponsored by Yvonne Conwell, allowed us to dramatically increase our eligibility specialists. And it's because of the comments we're hearing about the long wait times. I got to tell you, you won't hear many compliments when the wait is fast, when the call is short. I can tell you it happens. I can tell you right now. My father was talking with a gentleman last week, and he got on in 2 hours, and it took an extra hour and a half, and it got done. That's the process by design. But what I can tell you is Chris Ronayne and Yvonne Conwell dramatically increased the number of eligibility specialists just so we can drive those calls down. We totally share the view. It's not fast enough. We don't have enough staff. There was a time there were over 1,300 eligibility specialists in Cuyahoga County across 2 programs. There's about 500 right now. This is it. But what I can tell you is we're increasingly using technology. And Kevin and his team burned the midnight oil to write an AI grant recently to try to bring in some additional resources. They didn't get it, but they're still going to aggressively go after the next grant. They're using analytics, and they're using partnerships like we've never used before, and it's still not enough. But what I'll commit to is we're going to keep trying, and I know that we can do it because of the community that we represent and partnerships like we have here today. I think that might have been the last question. So Emily, anything else to share?
Well, I'm gratified by how many people are here today from a variety of places within our community, recognizing that this is a shared concern and consideration for all of us within our community, and how solutions focused the questions were. You know, we have a lot of great ideas floating in this room and around about how we can respond to this moment, and some good conversation that happened from the panelists. Thank you to the panelists as well for today. And up on your screen, you have some contact information from people from Cuyahoga Job and Family Services and others to continue to stay in touch.
Can we give 2 rounds of applause to Emily and to our panelists? And if you'll keep your applause going, to yourselves, to your neighbors, to everybody that you just met that came out tonight. Thank you, guys. Thank you. And I committed it tonight, so I'm sorry to put a little more work on our comms team, but I think we need to get this email registry going. We need to get you alerts when they happen. And to Gail's point, we need your advocacy every day we can get it. Thanks, everybody. We'll be back with some other town halls.